Hi, my name is Blake Anderson. I'm a physical therapist assistant student at Jeff State Community College. Today we'll be going over pharmacology for CABG and hypertension. CABG basically just stands for coronary artery bypass graft. So let's get started. So some of the points that we'll be going over the relationship between CABG, again, coronary artery bypass graft, and hypertension. We'll be identifying some medication used for these conditions, the purposes, the side effects these medications can present with, and how these medications can influence treatment and safety. Okay, so what is CABG and what is hypertension? So a coronary artery bypass grafting is a surgical procedure that restores blood flow back to the heart by bypassing blocked coronary arteries. Someone would need this usually if they are post-heart attack or if they have coronary artery disease. So hypertension is literally just a fancy word for high blood pressure. It's chronic elevations of high blood pressure, and that could be considered anything over like 130/80. Someone with hypertension has increased risk of things like heart disease, strokes, and a risk to need a coronary artery bypass graft. So metoprolol, beta blocker. The purpose is to lower your heart rate and blood pressure, which can also reduce the heart's workload. Whenever someone is on beta blockers, a patient's on beta blockers, you should always monitor their heart rate and blood pressure during therapy and know that heart rate response to exercise may be lower than expected. So some of these side effects that can come with beta blockers would be things like fatigue, dizziness, slow heart rate, and low blood pressure. So lisinopril is an ACE inhibitor. So again, its purpose is to lower blood pressure, just like the beta blockers, and protects cardiac muscles after surgery or a heart attack. So you should be aware of orthostatic hypotension and encourage slow position changes, like from sit to stand. Orthostatic hypotension is kind of like if you stand up too fast and you get really lightheaded. Obviously, except this is a little bit more extreme than that. They can have some, like in this little thing I got on the PowerPoint, they can pass out. There's a lot of things that can happen. So some side effects from ACE inhibitors can be things like dry cough, dizziness, hypotension, fancy word for low blood pressure, and elevated potassium levels. So a third medication could be something like aspirin. A lot of people know what aspirin is. It is a antiplatelet agent. Basically, its purpose is to prevent blood clots that could block the graft or block other arteries. Whenever someone is on aspirin, you should avoid deep tissue massages, monitor for bruising or bleeding. Some of the side effects can be increased bleeding risk, some stomach irritation, and bruising. So yeah, some cool statistics and takeaways that I found when researching this was around 400,000 CABG surgeries, coronary artery bypass graft surgeries, are performed every year in the U.S. Around half of U.S. adults have hypertension or have high blood pressure, and beta blockers, ACE inhibitors can reduce cardiac mortality by 20 to 25% when taken as prescribed. That's anywhere from 1 in 5 people to 1 in 4 people, which is a pretty big deal. So I got a few takeaways. Always assess blood pressure and heart rate before, during, and after treatment, especially if you know that some of these medications and their side effects. It's very important. Again, on this when we're on the topic of side effects, recognize all the side effects for each one of the medications and how they will present themselves, since every patient after one of these surgeries is most likely, or they are going to be on some sort of medication. So we do need to know the side effects. These are a few of my references. And that is it. Thank you.